Deadlift is a very effective exercise for increasing strength and muscle volume. In this video, I'll tell you what will happen to your body when you do deadlift every day. So watch the video till the end, it will be interesting. Let's go! Deadlift is a multi-joint basic exercise that involves lifting a barbell from the floor using the muscles of the legs and back. Scientists have proven that by performing the exercise regularly, you can protect the cruciate ligaments from ruptures, get rid of lower back pain, and reduce the risk of fractures. And of course, this exercise helps in developing strength and hypertrophy of specific muscle groups. When performing a deadlift, the muscles of the back, legs, abs, and arms are used to varying degrees. Trapezius and latissimus muscles, as well as back extensors, calf muscles, quadriceps, hamstrings, gluteal muscles, rectus abdominis, and obliques. In addition, the hands and forearms are worked for holding a heavy barbell. In addition, the exercise is useful for training the heart muscle. During exercise, the pulse accelerates and blood flows more effectively. This is important to consider for people who experience problems with the cardiovascular system. They should approach such training with caution and only after consulting a doctor. Deadlift has scientifically proven health benefits, but only with proper technique and adequate load. Deadlift allows you to work several muscle groups at once, helps increase strength and muscle size, and also spends a lot of calories. In addition, there are various studies that prove the positive effects of deadlifting on joints, ligaments, and the back, but only subject to the correct technique and regularity of exercise. A study analyzing the biomechanics of the deadlift states that, similar to the squat, by increasing stress on the hamstrings, the deadlift helps protect the cruciate ligaments during knee injury rehabilitation. Irish and Swedish scientists in two independent studies confirmed that deadlifts performed with a barbell help reduce back pain as well as improve physical condition and overall quality of life. In any case, no matter how good and reliable the research is, consult your doctor before doing any deadlifts if you have severe spinal injuries or other health problems. Deadlift has many contraindications. You cannot do deadlifts if you have injuries to the knees, spine, diseases of the cardiovascular system, high blood pressure, varicose veins, chronic diseases in the acute phase, or infectious diseases. It is very important to do deadlift with the correct technique, since there is a huge risk of injury. So let's look at the deadlift proper technique. Place your feet hip-width apart. Pull your hips back, tilt your body and grab the barbell. Straighten your chest and shoulders. Look forward. Tighten your back muscles and arc your lower back. Then lift the barbell. When you lower the barbell, move your pelvis back, only slightly bending your knees. Make sure that your back is straight during the deadlift. If you cannot maintain this position, probably you took too much weight. Improper execution of the exercise leads to various injuries and problems with the lower back. It bears the brunt of the load when lifting the barbell from the floor, and mistakes can cause pain. Now let's move on to the main mistakes. The first mistake is lack of stretching. Since the deadlift is a traumatic exercise that can cause harm if the technique is incorrect, you should not do it without stretching. To warm up, you can perform standing forward bends, splits, and other exercises. The second mistake is chasing more weight. When adding weight, make sure that your technique doesn't suffer. Increase the load gradually depending on how easily you are able to lift the weight during the previous set. The third mistake is doing it too often. For deadlifts, one workout per week is enough. However, in most cases, it is recommended to perform it at the beginning of the workout. The fourth mistake is lack of control over breathing and smooth movements. Performing deadlifts with proper form can reduce the risk of lower back injuries while increasing strength and muscle mass. The exercise is performed without jerking. Exhale when lifting the barbell, inhale when lowering. By the way, friends, be sure to watch other videos on this channel. Links are on the screen right now. See you soon!